If you want to pass the NCLEX-RN on your first try, you must master your medications, and antihypertensives are at the top of the list. In the next few minutes, we're going to tackle 10 real NCLEX-style questions that could make or break your score. Grab a pen, test yourself, and learn the exact rationales you need to never get these questions wrong again. Welcome back to the Nurse Navigator Network, your trusted source for NCLEX success. Today, we're diving deep into antihypertensive medications, from ACE inhibitors and beta blockers to calcium channel blockers and diuretics. Stay with me through all 10 questions and see how many you get right. Let's get started. Question 1. A patient is prescribed lisinopril for hypertension. Which electrolyte imbalance should the nurse monitor for? A. Hypokalemia B, hyperkalemia C, hypocalcemia D, hypernatremia. Answer B. Hyperkalemia. Rationale: ACE inhibitors like lisinopril block the conversion of angiotensin 1 to angiotensin 2, decreasing aldosterone secretion. Less aldosterone means the body retains potassium, leading to hyperkalemia. Always monitor potassium levels. Question 2. Which teaching point is most important for a patient starting a beta blocker like metoprolol? A. Take the medication at bedtime. B. Avoid eating grapefruit. C. Rise slowly from sitting or lying positions. D. Expect a dry cough. Answer C. Rise slowly from sitting or lying positions. Rationale: beta blockers can cause orthostatic hypotension. Patients should change positions slowly to avoid dizziness or falls. Grapefruit affects calcium channel blockers, not beta blockers. A dry cough is common with ACE inhibitors. Question 3. A patient on nifedipine develops swelling in the ankles. What is the likely cause? A. Allergic reaction. B. Fluid overload due to heart failure. C. Common side effect of calcium channel blockers. D. Kidney failure. Answer C. Common side effect of calcium channel blockers. Rationale: peripheral edema is a well-known side effect of calcium channel blockers like nifedipine due to vasodilation, causing fluid to pool in the extremities. Question 4. Which antihypertensive is contraindicated in pregnancy? A. Methyldopa. B. Labetalol. C. Enalapril. D. Hydralazine. Answer C. Enalapril. Rationale: ACE inhibitors like enalapril are teratogenic and contraindicated in pregnancy. Methyldopa and labetalol are commonly used for hypertension during pregnancy. Question 5. Which statement indicates correct understanding about hydrochloroioide? A. I should eat more potassium-rich foods. B. This will lower my potassium levels. C. This drug raises my blood sugar. D. All of the above. Answer D. All of the above. Rationale: thiazide diuretics can cause hypokalemia, so patients may need more potassium. They can also slightly increase blood sugar. So all statements are correct. Question 6. A patient taking clonidine reports drowsiness and dry mouth. What should the nurse do? A. Stop the medication immediately. B. Reassure the patient that these are expected side effects. C. Notify the provider for an antidote. D. Double the dose to reduce symptoms. Answer B. Reassure the patient that these are expected side effects. Rationale: clonidine, a centrally acting alpha-2 agonist, commonly causes sedation and dry mouth. These effects are not dangerous, but can affect compliance. Question 7. Which finding is most concerning in a patient taking furosemide? A. Blood pressure of 130/80. B. Potassium of 2.9. C. Urine output of 400 milliliters in 8 hours. D. Weight loss of 1 pound overnight. Answer B. Potassium of 2.9. Rationale: furosemide is a loop diuretic that causes potassium loss. A potassium level below 3.5 indicates hypokalemia, which can cause dangerous arrhythmias. Question 8. What is a serious adverse effect of ACE inhibitors? A. Weight gain. B. Increased libido. C. Angioedema. D. Photosensitivity. Answer C. Angioedema. Rationale. ACE inhibitors can cause life-threatening angioedema, rapid swelling of the face, lips, tongue, or throat. Patients should report any swelling immediately. Question 9. Which lab result would require the nurse to hold a dose of spironolactone? A. Sodium 138. B. Chloride 100. C. Potassium 6.0. D. Calcium 9.2. Answer C. Potassium 6.0. Rationale. Spironolactone is a potassium-sparing diuretic. A potassium level above normal 3.5 to 5.0 milliequivalent/L indicates hyperkalemia, which could worsen with the drug. Question 10. Which symptom should a patient taking Prozac report immediately? A. Drowsiness. B. Dry mouth. C. First dose syncope. D. Mild headache. Answer C. First dose syncope. Rationale. Prozac is an alpha-1 blocker that can cause severe orthostatic hypotension and fainting, especially with the first dose. Patients should take the first dose at bedtime and report any fainting episodes. You did it! You just reviewed 10 high-yield NCLEX questions on antihypertensive medications. How many did you get right? Drop your score in the comments below. Remember, mastering these details helps you care for real patients safely and pass the NCLEX with confidence. If you found this helpful, like this video, subscribe, and check out our next video for more NCLEX practice questions and tips. See you there.